A man that is a great candidate for a penile implant is any patient that desires a long-term or definitive solution for their erectile dysfunction. These men may have already tried and failed oral medications. Either they didn't work or they had bad side effects. They may have tried and failed injectile therapy for erections and may have not had good results with that, or unwanted side effects. Several different disease states can contribute to men wanting to have a penile implant for their erectile dysfunction. This would include men that have had prostate surgery, perhaps prostate removal for prostate cancer, radiation for other medical conditions or other cancer treatments, as well as other illnesses or injury that contribute their physical cause to their erectile dysfunction. In my experience in clinical practice, almost every man can be offered a permanent, definitive treatment solution to cure their erectile dysfunction. Many patients and couples ask me if the penile implant procedure is covered under their insurance plan. At this time, Medicare and Medicare with supplementals and most private insurance companies do provide and allow for the coverage of the procedure. Understand that this is a treatment for a medically diagnosed condition, not simply a cosmetic solution. My office, my administrative staff will work with you to help assess your coverage level for a penile implant as well as those benefits. We will also provide you with the diagnosis codes and the codes of the procedure that we perform to help you with your insurance coverage. There are several different types of penile implants available for patients in the United States. They are simply called the 1, 2, or 3-piece penile implants. Understand that for each patient and their anatomy, as well as the desired level of function, your selection may change in my office based on your situation, and that's why it's such an important individualized discussion. Understand that the 3-piece penile prosthesis is the most common type of implant that I place in my practice and usually provides the most functional result in the flaccid and erect states. The difference between a 1-piece or what we call malleable penile implant and a 3-piece inflatable penile implant is very easy to understand. The 1-piece implant is simply that. It is a bendable, flexible rod. An advantage of this is it's very easy to place for the surgeon and very easy to operate for the patient. However, it does have limited functionality, and then it does never get to the fully flaccid state and oftentimes is not fully erect enough for some patients and their partners to enjoy. In my opinion, the gold standard implant is the 3-piece inflatable penile implant. This device is what I implant the large portion of the time in my practice, and it is the most natural in the flaccid, non-erect, and erect states. This 3-piece penile implant has the highest patient and partner satisfaction of any of the 3 types of implants. I often am asked how the implants are sized for my patients. Understand that each implant is a custom fit for every patient at the time of your procedure. We take measurements on the inside of the erectile tissue to help determine the best fit and best device for you. Understand that the penile erection tissue is measured from the base of the penis, which is actually back towards the pelvic bone, all the way out to the middle of the glans or the head or tip of your penis. This custom measurement allows you the best fit and best result for you and your partner. The 3-piece inflatable penile implant is operated at your convenience like erections on demand. I simply tell my patients it's like having a remote control pump right inside your scrotum. That remote control, it sits right in between the testicles in the scrotal sac and is invisible to the outside world. To inflate the implant, you simply squeeze the bulb of the remote control. It transfers fluid into your erectile tissues. That fluid stays there and you keep an erection for as long as you would like. Even if you have a climax, your erection will not go down until it's under your control. To deflate the device, you simply squeeze a button that's at the top of the pump and the fluid cycles back into its holding reservoir. You may then inflate the implant as many times and leave it inflated for as long as you desire for you and your partner's satisfaction. Ejaculation, orgasm, and climax are not only usually the same with a penile implant, but they're oftentimes improved. The penile implant also does not change your urination. In fact, my patients with penile implants, because they're not worried about keeping or losing an erection, they're not on a time clock, and they don't feel like they're in a hurry for their intimate experience. My patients and their partners actually find that because they're more involved in the overall intimate experience, their ejaculation, climax, and orgasm may be significantly improved from before when they had the penile implant. Also, I find that many partners are pleased with the penile implant and their orgasm or climax because it certainly eliminates any time constraints or duration of erection, given that the erection is under you and your partner's control with the implant. The inflatable penile implant is a fully concealed device within your body. It is not detected by the outside world. In fact, airport security screeners and other security screeners cannot pick up the device. Penile implants are made of several very strong and durable materials that are designed to last for decades. These include materials like polyurethane and silicone-based materials that ensure a lasting definitive treatment solution for your erectile dysfunction. The solution that fills a penile implant is injectable saline. This is the same solution that would run through your veins if you were getting an IV. By having this safe fluid fill the implant, this means that if there ever should be a break in the system or a leak within the implant, your body would simply absorb this sterile injectable saline. The procedure to implant your penile device takes less than 1 hour. It is usually performed on an outpatient basis, which means that you come in and go to the hospital facility within the same day. A small opening is made in the middle of the scrotum. This usually provides space so that when you are healed, you cannot see or detect a scar. From there, 2 small openings are made in each side of the erectile tissue. This will accommodate the inflation portion of the penile device. A reservoir is placed down behind the pelvic bone next to your bladder. That allows for the filling and emptying of the device of the injectable saline. And finally, a small pump is placed in the scrotum that allows you to operate the device at your leisure. The recovery process for a penile implant procedure is usually just a few weeks. I will see you in the office the first day after your procedure to remove a drain. A few weeks later, I will see you in the office to check your incision and make sure you're healing appropriately. And just a few weeks after that, we'll have you in for your activation visit, where we teach you and your partner how to operate the device. Once you have healed appropriately, patients can usually use their penile implant device in 4 to 6 weeks. Current advancements in technology in terms of the development of today's penile implant allows most men to have a greater than 15-year life expectancy with the device. Should the device ever malfunction or break down, it may certainly be replaced with a simple, short procedure. The definitive treatment solution of a penile implant provides the highest patient and partner satisfaction rates of any therapy for erectile dysfunction. This includes a patient and partner satisfaction rate of over 96%. The most common risk of the penile implant procedure is infection. However, this is rare and infection rates are very low, especially in the hands of an experienced implanter. The device over time could migrate or malfunction, and that certainly can be solved by replacing the device in a short procedure.